Hi, everybody. Ian Bremmer here, and it is yet another week of shutdown here in New York City, in most of the country, and indeed for more than 50% of the planet, presently locked in place, more or less. Impact of that on the global economy is pretty extraordinary. You see oil prices in the floor. Because turns out when you shut down global supply and demand for the economy, you don't need a lot of energy. And indeed, when you only have a limited amount of places to store that energy, the further production is nearly worthless. So there's that. But the coronavirus itself, I mean, looking at what's coming over the next few weeks, I worry here in the United States that what has been politically reasonably functional so far, and I use that term advisedly, is about to become much, much less so. I mean, those of you that are actually watching the White House press conference every day, and if you do, then you probably watch some cable news right afterwards, right? And that's a complete shit show. We understand that. I don't watch it. I don't think you need to. It's made for television political theater and drama. But the actual policies we've seen from the United States so far have been reasonably coordinated. What do I mean by reasonably coordinated? Well, first, on the finance side, Fed Chief Jay Powell has been very effective and early in not just getting rates down, but also providing credit lines where necessary across the economy. Fiscal stimulus has been fast, has been bipartisan largely. There's going to be more coming relatively short order for the small businesses and NGOs that had the initial hundreds of billions depleted quite quickly. That looks pretty close to passage. And also the fact that the shutdowns of government, even though there was a lot of question of who has the authority, it's my authority as the president. No, it's not really. The reality is the governors are in charge. The governors engaged in the shutdowns. They didn't do so politically. They basically engaged in shutdowns as they realized they needed to engage in shutdowns. That's been fairly straightforward. The big problem was directly on healthcare, and that was less about politics than simply the fact that the United States didn't have testing and didn't have adequate stockpiles of healthcare materials. When the World Health Organization offered a test, the Americans didn't use it. To be fair, the Americans usually use local CDC-produced tests. When it was clear that they weren't working, they could have gone to use a WHO-approved test like the Germans. We didn't do that. So that hurt, and it hurt that we were late in coordinating and stockpiling critical healthcare material. That definitely meant that people were more worried than they might have otherwise been, that the healthcare systems weren't going to work. But ultimately, that equipment got there. Ultimately, the masks got there to the people that most needed them, the healthcare workers, and that meant that we didn't see large numbers of healthcare workers getting sick and dying like you saw in northern Italy, and you never saw triaging of large numbers of people that needed critical care. So that's where we've been. But going forward, it's going to get a lot more political, and I think for a few reasons. First, because even though we have healthcare systems that have surged, we don't have adequate testing to be able to say effectively that quarantines have worked the way we want to and that we know we can reopen economies. But the pressure to reopen economies now that you've surged your healthcare is going to be massive because people are suffering. They're suffering from not being able to get to work. They're suffering because the economy is falling apart. They're suffering because they don't have childcare and the kids can't go to school, all of these things. So the pressure to restart economies is going to be immense. That would be a lot easier to deal with if you had the kind of contact tracing and had the kind of tests that we have seen early stage in Germany or we saw in early stage South Korea. What's going to happen is that some states will have those tests up and running, others will not. It'll be coordinated locally, not nationally, and as they open, some states will need to close again. And that'll be, according to the White House guidelines, is that 2 weeks later, in order to go from phase 1 to phase 2, you have to see that you're not getting additional cases. You're going to see additional cases. That's going to be a serious problem. People are going to be going back to the hospital. That's already started in Kentucky, for example. Is that going to slow them down? I hope it does. And the fact that this is really being done state by state is going to prove very problematic as the U.S. economy starts reopening, and also as, and all epidemiologists expect this, we get second outbreaks either this summer or in fall and winter. So that's a little bit over the coming weeks. I also think on the fiscal side, we've got the $2 trillion done. We're going to see another $2 trillion done. That is almost all relief for having shut down the economy. But what about stimulus? What about getting companies going again, getting the economy going again as we start reopening, summer and fall? That's not going to be easy. That's not going to be politically bipartisan and coordinated like the last few tranches have been. It'll be much more politicized as the election is getting closer. And that means either there's going to be massive overspending and waste, which will cause a political bun fight afterwards and big fights, or it means that you're not going to get adequate cash to those that most need it, and that's going to limit the ability of the American economy to rebound. You're going to see similar problems in Europe, but that's because there's no Europe. There's nowhere close to a willingness of the Europeans as a whole to provide the kind of redistribution of wealth, of debt, that would be required to get the Italians, the Spaniards, the Portuguese growing again. So the Germans are running very well domestically, the Danes, the Netherlands, but you don't see that in the South. You don't see that in Eastern Europe. The potential that creates an existential crisis for the Eurozone is real. Finally, so much to talk about always with China. And I've already discussed on previous videos how, one, they were responsible for the initial cover-up, but two, once they started focusing on the crisis, they actually did an extraordinary job, empowered by technology, surveillance on the ground, able to quarantine and prevent significant additional outbreaks. No, I don't trust their numbers, but I do trust the fact that their economy is seriously up to speed again in a way the Americans and Europeans are going to have a much harder time. What's interesting is that internationally, the Chinese are playing much less of a leadership role than they are domestically now that they have the crisis under more or less wraps. And what I mean by that is they made big press in initially sending some healthcare equipment, some medical equipment and personnel to the Europeans and other countries. It's been relatively small. There hasn't been big follow-through. It's mostly press. This is not the Americans in Indonesia after the tsunami. It's not anywhere close to what the Chinese are capable of doing, what these countries actually need. That is causing a fair amount of blowback. We're seeing it from German media institutions, from the French, from the UK, and especially from African countries, because a lot of Africans have been treated so badly on the ground in China as well. The Chinese haven't handled that well. It's going to get bigger, because going forward, I've heard from a lot of the heads of the international financial institutions that the Chinese are nowhere close to offering the kind of money and support that these countries desperately need. So the Americans and Europeans are going to be focused on their own crises, and that's going to be massively expensive for these countries. So their willingness to provide international aid will be more constrained, while the Chinese, less constrained, second largest economy in the world, not providing leadership, very little cash they're going to be willing to put up, which means the developing world is going to be really on the back foot in 3 and 6 months' time. And also the idea that China is going to be suddenly replacing the United States providing leadership. You saw in the Economist magazine this week, China winning out of coronavirus. Well, it's clear that the Chinese economy is doing much better. Their growth this year, next year will look a lot better than the Americans, the Europeans. They will be gaining on the Americans in terms of the gap in size of economy and impact of the economy. But in terms of providing international leadership, there I don't see the Chinese playing much of a role at all, and it's important not to get ahead of ourselves on that one. So anyway, that's kind of where we are right now. I'll have more for you later on in the week. I hope everyone is doing well, staying safe, and avoiding people. Be good.